All right, so let's talk about the school age child. So school age, we're talking about ages from about 6 to 12 years. So we're talking about that period of time where the child is past, that preschool age. We're in formal school, but we're not quite an adolescent. We're not quite prepubescent until the end of this school age period. And during this period of time, gradual growth and development continue to occur. We continue to refine our physical and fine motor, gross motor skills and things like that. We're learning to write. We're really learning scholastic learning and things like that. And we continue to grow physically and emotionally. So height increases about 2 inches per year, weight about 2 to 3 kilograms per year. And this is the period of time, especially in early school age, where male and females are about equal. They differ little in size. And we know, of course, as we get later into school age, that does change. But during this early school age period of time, they differ a little. So bladder capacity is increasing. The heart is smaller. It's efficient. Immune system is much better at fighting off illnesses. Bones increase in ossification, and this is especially the case in females. And one thing to point out, and this is important as the NP or that's providing care, is that physical maturity is not necessarily correlated with emotional or social maturity. And so you may see a child that looks very much like an adult, but remembering that, some girls go into puberty as early as 8 and 9 years old. And so their body is well ahead of their emotional and social maturity. So this period of prepubescence, I really want you to zero in on this and make sure that you know this. And it's defined as the 2 years preceding puberty. Okay, so this typically occurs during pre-adolescence, and it's varying in ages, but it's anywhere from 9 to 12 years. And in girls, it occurs about 2 years before boys. The average age of puberty is 12 years in girls, and it's 14 years in boys. So keep this in mind and make sure that you know these ages. So psychosocial development, relationships are centering around same-sex peers. So we're playing sports, we're on teams, we have our girlfriends that we, are on the cheer team or the swim team or the soccer team together, and vice versa for boys as well. And so very much driven by that same-sex relationship and camaraderie. Okay, so Erikson, we're developing that industry. Okay, so the infant was attachment, the toddler autonomy, and the preschooler, and now we're doing the school age of industry. Okay, so they're eager to develop skills. They're eager to work in groups. They're eager to be independent in how they do things. They want their peers to like them. They want to be good at things. And this is a very big, strong motivator for them. So Piaget, we're still pretty concrete. We're developing our understanding and relationships between ideas and things like that, but we're still concrete in so many ways. They do begin to start making judgments on things, and not just judgments that seem simple, but sometimes as this develops, it's based off of reason, and this is a good sign that you see in this period of time. So as I mentioned before, this peer group is extremely important for them. And this helps them have this identity that they're going to go into adolescence, and sort of start to form that on many different levels. Their peers are a strong influence, and during this period of time, of this school age period of time, they're developing and gaining independence from their parents, and so their peers have a big role in how efficient that is. So parents are still the primary influence in the child's life, and they need control, they need boundaries, they need their parents in their life in a very significant way. But as you get deeper into the school age period and closer to adolescence, you do see that increasing independence from parents, and that ability to separate and form their own ideas and be independent in many ways. So play, like all kids, is a big thing for them. This is where you start to see groups, clubs, cliques, these secret societies that they form, and that they're doing this with groups that help them to gain their independence, to gain their identity, and they flock, or they sort of gravitate to people that are like-minded, and this is very, very common during this period of time. So team play is a big part of their lives at this point. They want to be a part of teams. They want to work towards common goals. But in the other side, quiet games, activities really become a big part of, excuse me, of their life, and they can participate in these games and understand them and play by the rules and all of these types of things, and it becomes a very big part of their development. Are these quiet sort of individual yet group games. Okay, sex education, of course, it's normal to be curious. They're very curious. Parents will ask, when is it the right time to start talking about this? All the literature sort of points towards this middle childhood for that sort of ideal time. This is when they, start to have that deeper curiosity of, where do these babies come from and how does everything work and all of that. And of course, this is appropriate because they're getting closer to that adolescent period of time where they're asking themselves, who am I? What, that identity, finding that identity. And that has to do with their sexual identity, among many other things. And so it's very important that we encourage parents to communicate with their child about, sex and answer their questions, because reality is that they're going to find answers. And it's better if they can get answers from their parents so that their parents can tell them exactly what they want them to know. I always encourage that. And you may even have parents ask you to talk to them about it. And that's really not uncommon. It happens quite a bit. So this self-concept, they've developed this conscience. They are aware of their abilities, their appearances in regards to others' abilities and appearances, and this really begins to start to shape their self-concept. You can see children with low self-esteem, depression, anxiety as young, very, very young. When this starts to develop is when they start to question these things, and you can see these ramifications psychologically, where you have children that are sad and things like that. And on the flip side, it can be a very positive thing as well when they develop self-respect, self-confidence, and it's our job to sort of help build that up in them, and find something positive. One thing that I always ask, when I'm in the office and I'm seeing a child school age into adolescence, is I say, what's your favorite thing? A child who doesn't have a favorite thing, that's a red flag. Now, I also think a child that says, well, I play video games by myself all the time and that's my favorite thing, that's also a red flag. Are they inclusive? Are they, sort of reclusive? And therefore, are they at risk for different types of psychological things that, could influence them? Okay, this body image, of course, they're wondering if they're like everybody else. This is the most common question that I get when I see these pre-adolescent, prepubescent girls and boys is everything that's going on with me what's going on with everybody else? Am I normal type thing? And so I always reassure them. I look at growth curves with them. I show them what they're doing, show them what they're growing. I talk about the norms and, what we typically see. I talk to them about timelines and things like that. This is especially important for girls because they are, even if they don't come out and say it, they want to know when they're going to start their period. They want to know what's going to happen. They want to know, what are the signs and everything like that. So we talk about that. And it really helps them develop that self-confidence and have that positive body image. So nutrition is important. We're now on team sports, so we're out late. We now have homework. Now we're eating lots of fast food. And everything is go, go, go. And so we can develop a lot of poor habits. And it's even common in those kiddos that are thin, that are eating poor meals and nutrition, and they're thin because they're so active, but they're not getting the nutrients they need for maximum and optimal growth. Okay, sleep. They need, I would say, about 9.5, 10 hours is about what they need. About the time you're getting to adolescence, they're a little bit less resistant to bedtimes, but they need their rest. They grow when they sleep, and I always tell them that, you grow when you sleep, and your brain packs away all of the information that it learned in that day. And so it's very, very important making sure that technology is turned off 2 hours before they're ready to go to bed, so that their brain has time to shut down and unwind. If not, they may go to sleep, but their brain is still revved up and it's not getting into that deep sleep where they are recuperating through the night. Sports, of course, there's that whole controversy of early participation versus, sort of the more laid back competition or very intense competition. The big thing is to make sure that it's healthy and, that the child's happy and that they're safe and they're not overworking their bodies. We have permanent teeth coming in during this time, so we will start to see baby teeth, deciduous teeth start to fall out. And it's important that we have good dental health, that they have regular visits, that they're flossing and brushing twice a day. And then, of course, injury prevention, bicycle injuries, car injuries, motor vehicle injuries. Again, I talk about the fact that they should not be sitting in the front seat. Most kids still need to be in a booster seat during this period of time, and most kids aren't. So lots of discussion about that injury prevention, and especially when it comes to motor vehicle